Lead poisoning is a type of metal poisoning and a medical condition in humans and other vertebrates caused by increased levels of the heavy metal, lead in the body. Lead interferes with a variety of body processes and is toxic to many organs and tissues including the heart, bones, intestines, kidneys, and reproductive and nervous systems. It interferes with the development of the nervous system and is therefore particularly toxic to children, causing potentially permanent learning and behavior disorders. Symptoms include abdominal pain, confusion, headaches, anemia, irritability, and in severe cases seizures, coma, and death. Routes of exposure to lead include contaminated air, water, soil, food, and consumer products. Occupational exposure is a common cause of lead poisoning in adults. According to estimates made by the National Institute of Occupational Safety and Health, more than 3 million workers in the United States are potentially exposed to lead in the workplace. One of the largest threats to children is lead paint that exists in many homes, especially older ones. Thus, children in older housing with chipping paint or lead dust from movable window frames with lead paint are at greater risk. Prevention of lead exposure can range from individual efforts to nationwide policies. Elevated lead in the body can be detected by the presence of changes in blood cells visible with a microscope and dense lines in the bones of children seen on X-ray. But the main tool for diagnosis is measurement of the blood lead level. When blood lead levels are recorded, the results indicate how much lead is circulating within the bloodstream, not the amount stored in the body. There are two units for reporting blood lead level, either micrograms per deciliter, or micrograms per 100 grams of whole blood, which are numerically equivalent. The Centers for Disease Control has set the standard elevated blood lead level for adults to be 10 micrograms (dl) of the whole blood. For children the number is set much lower at 5 micrograms (dl) of blood as of 2012, down from a previous 10 micrograms (dl). Children are especially prone to the health effects of lead. As a result, blood lead levels must be set lower and closely monitored if contamination is possible. The major treatments are removal of the source of lead and chelation therapy. Humans have been mining and using this heavy metal for thousands of years, poisoning themselves in the process. Although lead poisoning is one of the oldest known work in environmental hazards, the modern understanding of the small amount of lead necessary to cause harm did not come about until the latter half of the 20th century. No safe threshold for lead exposure has been discovered, that is, there is no known sufficiently small amount of lead that will not cause harm to the body. Classification. Classically, lead poisoning, or lead intoxication, has been defined as exposure to high levels of lead typically associated with severe health effects. Poisoning is a pattern of symptoms that occur with toxic effects from mid to high levels of exposure. Toxicity is a wider spectrum of effects, including subclinical ones. However, professionals often use lead poisoning and lead toxicity interchangeably, and official sources do not always restrict the use of lead poisoning to refer only to symptomatic effects of lead. The amount of lead in the blood and tissues, as well as the time course of exposure, determine toxicity. Lead poisoning may be acute or chronic, but the latter is much more common. Diagnosis and treatment of lead exposure are based on blood lead level, measured in micrograms of lead per deciliter of blood. Urine lead levels may be used as well, though less commonly. In cases of chronic exposure, lead often sequesters in the highest concentrations, first in the bones, then in the kidneys. If a provider is performing a provocative excretion test, or chelation challenge, a measurement obtained from urine rather than blood is likely to provide a more accurate representation of total lead burden to a skilled interpreter. The U.S. Centers for Disease Control and Prevention and the World Health Organization state that a blood lead level of 10 micrograms (dl) or above is a cause for concern. However, lead may impair development and have harmful health effects even at lower levels, and there is no known safe exposure level. Authorities such as the American Academy of Pediatrics define lead poisoning as blood lead levels higher than 10 micrograms (dl). Lead forms a variety of compounds and exists in the environment in various forms. Features of poisoning differ depending on whether the agent is an organic compound or an inorganic one. Organic lead poisoning is now very rare, because countries across the world have phased out the use of organic lead compounds as gasoline additives. But such compounds are still used in industrial settings. Organic lead compounds, which cross the skin and respiratory tract easily, affect the central nervous system predominantly. Signs and symptoms. Lead poisoning can cause a variety of symptoms and signs which vary depending on the individual and the duration of lead exposure. Symptoms are non-specific and may be subtle, and someone with elevated lead levels may have no symptoms. Symptoms usually develop over weeks to months as lead builds up in the body during a chronic exposure, but acute symptoms from brief, intense exposures also occur. Symptoms from exposure to organic lead, which is probably more toxic than inorganic lead due to its lipid solubility, occur rapidly. Poisoning by organic lead compounds has symptoms predominantly in the central nervous system, such as insomnia, delirium, cognitive deficits, tremor, hallucinations, and convulsions. Symptoms may be different in adults and children. The main symptoms in adults are headache, abdominal pain, memory loss, kidney failure, male reproductive problems, and weakness, pain, or tingling in the extremities. Early symptoms of lead poisoning in adults are commonly nonspecific and include depression, loss of appetite, intermittent abdominal pain, nausea, diarrhea, constipation, and muscle pain. Other early signs in adults include malaise, fatigue, decreased libido, and problems with sleep. An unusual taste in the mouth and personality changes are also early signs. In adults, symptoms can occur at levels above 40 micrograms (dl), but are more likely to occur only above 50 to 60 micrograms (dl). Symptoms begin to appear in children generally at around 60 micrograms (dl). However, the lead levels at which symptoms appear vary widely depending on unknown characteristics of each individual. At blood lead levels between 25 and 60 micrograms (dl), neuropsychiatric effects such as delayed reaction times, irritability, and difficulty concentrating, as well as slowed motor nerve conduction and headache can occur. Anemia may appear at blood lead levels higher than 50 micrograms (dl). In adults, abdominal colic, involving paroxysms of pain, may appear at blood lead levels greater than 80 micrograms (dl). Signs that occur in adults at blood lead levels exceeding 100 micrograms (dl) include wrist drop and foot drop, and signs of encephalopathy, such as those that accompany increased pressure within the skull, delirium, coma, seizures, and headache. In children, signs of encephalopathy such as bizarre behavior, discoordination, and apathy occur at lead levels exceeding 70 micrograms (dl). For both adults and children, it is rare to be asymptomatic if blood lead levels exceed 100 micrograms (dl). Acute poisoning and acute poisoning. Typical neurological signs are pain, muscle weakness, paresthesia, and, rarely, symptoms associated with encephalitis. Abdominal pain, nausea, vomiting, diarrhea, and constipation are other acute symptoms. Lead's effects on the mouth include astringency and a metallic taste. Gastrointestinal problems, such as constipation, diarrhea, poor appetite, or weight loss, are common in acute poisoning. Absorption of large amounts of lead over a short time can cause shock due to loss of water from the gastrointestinal tract. Hemolysis due to acute poisoning can cause anemia and hemoglobin in the urine. Damage to kidneys can cause changes in urination such as decreased urine output. People who survive acute poisoning often go on to display symptoms of chronic poisoning. Chronic poisoning usually presents with symptoms affecting multiple systems, but is associated with three main types of symptoms: gastrointestinal, neuromuscular, and neurological. Central nervous system and neuromuscular symptoms usually result from intense exposure, while gastrointestinal symptoms usually result from exposure over longer periods. Signs of chronic exposure include loss of short-term memory or concentration, depression, nausea, abdominal pain, loss of coordination, and numbness and tingling in the extremities. Fatigue, problems with sleep, headaches, stupor, slurred speech, and anemia are also found in chronic lead poisoning. Lead hue of the skin with pallor or lividity is another feature. A blue line along the gum with bluish-black edging to the teeth, known as a Burton line, is another indication of chronic lead poisoning. Children with chronic poisoning may refuse to play or may have hyperkinetic or aggressive behavior disorders. Visual disturbance may present with gradually progressing blurred vision as a result of central scotoma, caused by toxic optic neuritis. Effects on children. A fetus developing in the womb of a woman who has elevated blood lead level is susceptible to lead poisoning by intrauterine exposure, and is at greater risk of being born prematurely or with a low birth weight. Children are more at risk for lead poisoning because their smaller bodies are in a continuous state of growth and development. Lead is absorbed at a faster rate compared to adults, which causes more physical harm than to older people. Furthermore, children, especially as they are learning to crawl and walk, are constantly on the floor and therefore more prone to ingesting and inhaling dust that is contaminated with lead. The classic signs and symptoms in children are loss of appetite, abdominal pain, vomiting, weight loss, constipation, anemia, kidney failure, irritability, lethargy, learning disabilities, and behavioral problems. Slow development of normal childhood behaviors, such as talking and use of words, and permanent intellectual disability are both commonly seen. Although less common, it is possible for fingernails to develop leuconica striata if exposed to abnormally high lead concentrations. Complications. Lead affects every one of the body's organ systems, especially the nervous system, but also the bones and teeth, the kidneys, and the cardiovascular, immune, and reproductive systems. Hearing loss and tooth decay have been linked to lead exposure, as have cataracts. Intrauterine and neonatal lead exposure promote tooth decay. Aside from the developmental effects unique to young children, the health effects experienced by adults are similar to those in children, although the thresholds are generally higher. Kidney damage occurs with exposure to high levels of lead, and evidence suggests that lower levels can damage kidneys as well. The toxic effect of lead causes nephropathy and may cause Fanconi syndrome, in which the proximal, tubular function of the kidney is impaired. Long-term exposure at levels lower than those that cause lead nephropathy have also been reported as nephrotoxic in patients from developed countries that had chronic kidney disease or were at risk because of hypertension or diabetes mellitus. Lead poisoning inhibits excretion of the waste product urate and causes a predisposition for gout, in which urate builds up. This condition is known as saturnine gout. Cardiovascular system evidence suggests lead exposure is associated with high blood pressure, and studies have also found connections between lead exposure and coronary heart disease, heart rate variability, and death from stroke. But this evidence is more limited. People who have been exposed to higher concentrations of lead may be at a higher risk for cardiac autonomic dysfunction on days when ozone and fine particles are higher. Reproductive system. Lead affects both the male and female reproductive systems. In men, when blood lead levels exceed 40 micrograms (dl), sperm count is reduced and changes occur in volume of sperm, their motility, and their morphology. A pregnant woman's elevated blood lead level can lead to miscarriage, prematurity, low birth weight, and problems with development during childhood. Lead is able to pass through the placenta and into breast milk, and blood lead levels in mothers and infants are usually similar. A fetus may be poisoned in utero if lead from the mother's bones is subsequently mobilized by the changes in metabolism due to pregnancy. Increased calcium intake in pregnancy may help mitigate this phenomenon. Nervous system lead affects the peripheral nervous system and the central nervous system. Peripheral nervous system effects are more prominent in adults and central nervous system effects are more prominent in children. Lead causes the axons of nerve cells to degenerate and lose their myelin coats. Lead exposure in young children has been linked to learning disabilities, and children with blood lead concentrations greater than 10 micrograms DL are in danger of developmental disabilities. Increased blood lead level in children has been correlated with decreases in intelligence, nonverbal reasoning, short-term memory, attention, reading and arithmetic ability, fine motor skills, emotional regulation, and social engagement. The effect of lead on children's cognitive abilities takes place at very low levels. There is apparently no lower threshold to the dose-response relationship. Reduced academic performance has been associated with lead exposure even at blood lead levels lower than 5 micrograms DL. Blood lead levels below 10 micrograms DL have been reported to be associated with lower IQ and behavior problems such as aggression. In proportion with blood lead levels, between the blood lead levels of 5 and 35 micrograms DL, an IQ decrease of 2 to 4 points for each μg DL increase is reported in children. High blood lead levels in adults are also associated with decreases in cognitive performance and with psychiatric symptoms such as depression and anxiety. It was found in a large group of current and former inorganic lead workers in Korea that blood lead levels in the range of 20 to 50 micrograms DL were correlated with neurocognitive defects. Increases in blood lead levels from about 50 to about 100 micrograms DL in adults have been found to be associated with persistent, and possibly permanent, impairment of central nervous system function. Lead exposure in children is also correlated with neuropsychiatric disorders such as attention deficit hyperactivity disorder and antisocial behavior. Elevated lead levels in children are correlated with higher scores on aggression and delinquency measures. A correlation has also been found between prenatal and early childhood lead exposure and violent crime in adulthood. Countries with the highest air lead levels have also been found to have the highest murder rates, after adjusting for confounding factors. A May 2000 study by economic consultant Rick Nevin theorizes that lead exposure explains 65% to 90% of the variation in violent crime rates in the U.S. A 2007 paper by the same author claims to show a strong association between preschool blood lead and subsequent crime rate trends over several decades across 9 countries. It is believed that the U.S. ban on lead paint in buildings in the late 1970s, as well as the phase-out of leaded gasoline in the 1970s and 1980s, partially helped contribute to the decline of violent crime in the United States since the early 1990s.